task number 18, so we're going to do a bacterial culture. So we have collected our urine by cysto. So we're going to go ahead, and the first thing we want to do is label our disc with our patient's name, today's date, and that it is urine. Okay. So then we're going to go ahead, open up our sterile swab here. Open up our urine. Gently insert this without touching the sides so that we can get our sample on there. Okay, then we're going to take our disc and we're going to hold it at an angle, and we are going to just rub our sample gently across there so that we get a good amount on each section. Then we're going to place our lid back on. And we're going to go ahead and put some tape on there so that we can keep it closed. So then this is then going to go into the incubator for 24 hours, and we will come back to check to see if we have any growth. If we do, then we'll go ahead and take a part of that onto another disc and move on to adding the penicillin. So we're just going to place that in there and close our lid, and then we will be back for part B tomorrow. Okay, so we are back for the second portion of task 18. So we have removed our disc from our incubator. So as you can see, the normal lines here, and then we do have some colony growth here. So if you look at our screen, you can see I obviously forgot to draw the line, the lines that go across. So that looks, normal there for what we were seeing here. And then if you click here, you can see that there is some colony growth on here as well. On ours, it's up near the top. So and then there's a couple little spots on the bottom. So what we're going to do is go ahead and open ours up. And then we don't have the actual tool to pull out the medication. We're using penicillin because we don't normally do this. So we're going to use a pair of sanitized forceps here. So then we're going to just remove this, and we're going to gently grab a disc here. Okay. And then we are just going to place this in here gently where we have our colony growth. Okay. So then we're going to go ahead, place our lid back on. Just a little bit of tape back on here too so that we can hold it in place. And then we're going to go ahead and take this back to the incubator again. And we're going to place that back in there for another 24 hours. And then in 24 hours we'll come back and we'll see if anything has grown around the discs or if it's grown away from the disc. Okay, this is the third step of our task 18. So we're going to go ahead and remove our disc from our incubator here. And so then we're going to go ahead and walk out to the computer and look at our results and do some comparing. So on our disc, as you can see, we use penicillin. And as you can see, it still continued to grow around it. So it does show that it has a resistance to penicillin at this point. So we will let the doctor know so that she can decide if there's another antibiotic that she would like to try. And so if you look at our computer screen here, this shows you the same disc that we just used. On this one here, it shows that whatever the bacteria was, did not have a resistance to these antibiotics that they tried, but did have a resistance to this antibiotic. And the same thing on this side here, these two were okay with no resistance, and it had a resistance here. So now what we're going to do is place our results into the chart. And so we are just going to write that the bacteria shows a resistance to penicillin. Oops. And then, like I said, we're going to go ahead and let the doctor know so that she can determine the next course of action and determine what she would like to do regarding the treatment of this patient. So, and as you can see here, here's another disc with a bunch of different growths on it. I don't see any bacterial discs in there. So that is now the end of task 18.